Hey everyone, it's Dr. Joe and Carl here, and we're going to have a new monthly segment called Field Notes with Carl, where Carl and I talk about some topics that we think might interest you guys. So today we're going to talk a little bit about flea and tick products and prevention. Now, I get asked all the time about natural flea and tick products and which do I think is safe and which ones do I think might work aside from the pharmaceuticals. And the unfortunate answer is really none of them. One of the biggest things that I hear people talk about giving is garlic for their pets. And unfortunately, fleas and ticks are not vampires, and so they do not help. Garlic does not keep them away. What actually happens is that it can be very unsafe for our pets. They're part of the allium family, as well as onions, leeks, and chives. And what happens when we feed large amounts of garlic or any other products in the allium family is that they cause red blood cell dyscrasias, and they can cause anemia in our pets. Red blood cells are necessary to bring oxygen to the lungs and to our organs, or take oxygen from our lungs to our organs. And so if we give large volumes of garlic, we can actually cause more harm than good in our pets. I've also had people ask me about lemongrass or other essential oils or even other spices like oregano. And unfortunately, I just don't feel like any of them work consistently enough for me to feel comfortable recommending them. There may be a product that works for your pet, but maybe doesn't work for another pet. So unfortunately, my answer is most of the time, nothing. As far as pharmaceutical goes, I always recommend to talk to your primary veterinarian about what they feel is best for your pet. They know your pet and they should know your concerns going into using a pharmaceutical for your pet. In our house, for Carl and Nina, I use Simparica. My dogs do not have any sort of a seizure disorder. So Simparica, Bravecto, NexGard, and Credelio all belong to a family called isoxazolines, and they have been known to lower the seizure thresholds in dogs, and they must be used in extreme caution in those dogs with seizures. The other options are topicals that you can purchase over the counter, such as Frontline or Advantage or Advantix for ticks. Those products do work for the most part, but quite as well as the tablets that you can get from your veterinarian with a prescription. There's other products available as well that are not a name brand, that are maybe less used. And those products can actually be very scary. Over my years of being a veterinarian, I have seen many cats that these over-the-counter topicals have been applied to them. And unfortunately, they have had chemical burns on their skin, or they have had seizures because the products just are not safe. So if you're going to use a product, make sure you ask your veterinarian first if that's safe for your pet to be able to use. There's also collars that are available, and the only collar that I recommend is the Seresto collar. It lasts for 8 months. It must be fitted snugly against your pet's neck for the product to be released. But for the most part, it is safe. But again, these are all products that you need to discuss with your veterinarian to make sure that it is the best product for your pet. We hope that you enjoy these monthly videos. If there is a topic that you would like covered, please send us an email at drjoepetvet@gmail.com and we'll add it to the list. Next month is going to be about food, which is Carl's favorite subject. Isn't it, Carl? Are you hungry? He's always hungry. Thanks, guys. We'll see you next month.